mother-in-law unit. So
Perfect.
fingers crossed.
Okay,
I'll keep y'all posted.
yay.
I told Dana she should join us too from the jail. I think she would be a good addition.
Just need to get that Tay person. Give me a youngster.
Yeah,
We can't have under 18. I mean, asked
we can't have what?
somebody who's under 18. I have a super motivated youngster who is 17 almost. But Tim Doty.
Hello, hello.
Oh, Kirsten Sumner.
I love that. That's awesome.
This is
We
like,
should do that for every person that
cheers.
comes in.
Where everybody knows your name.
Cheers. How you doing, my friend? I should have bought something to drink.
Oh, you have time.
I do have time.
Go grab it.
Can I run out really quick?
Yeah. Not your mom.
Do you want something?
No. Look at you. You sell a sweatshirt and all.
Big game this weekend. They are our tribals. Who is? Gotta get into the spirit something, right?
We have 2 meetings, missed. I haven't read them. Please, read them. Need voters.
This is the last time we're gonna vote on the bylaws. This is it. The next 10 years, next day,
10 years.
we can vote on it
That's what the
again.
state does.
County council isn't happy with it.
Hey. Good. Hey, there he is.
Morning. There's still morning, right? No.
Nope.
Officially not. And that's why, I knew that's why you didn't answer your phone up to me.
That is you, right?
Yeah. Yeah. We have a guy that.
We are very, I am very well acquainted with him.
Yeah. Well,
Tim, you look great.
I,
Nothing wrong with him. You look fabulous.
I just, he was complaining about some things that I wasn't gonna do what you could complain about. I was like, well, you can call 911. He goes, I don't know. Huh?
No, I'm off because of my medical leave.
What's that?
Oh, yeah, I got into the ring. Oh. That's all right.
With the elevator.
Yeah, my passions. Good morning, how are you?
How's it
Yeah,
going?
my medical leave is over now.
Lovely, 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 lovely.
Oh, really? Not until you can walk up the
Sorry.
stairs. but-
Yeah.
You think Megan will be in tomorrow? Yeah, so,
My ready?
yeah,
We're moving offices.
that's why she wasn't in court? Oh, that's there.
I'm not sure why she wasn't in court, but I can tell you that, she was at the other office. And I think that there was maybe somebody else doing that case for her.
Well,
Well,
wait,
if you want.
they forgot it off on 19th.
Well, that's good, that gives me more time to get her published. However, because she got put up to the 19th, because Megan wasn't there.
Oh,
Yeah, I don't know what to say about that.
yeah, so I think she's a little distressed.
I bet. I'm sorry, I didn't know the whole story.
That's okay, I will check in with the boss tomorrow or later.
Yeah,
Hey.
how are you?
I don't know how everybody has their spots. and it's
Starving.
where they sit.
Do you need this?
You
Yeah,
said
I
this,
sent him.
I got it. Yeah, I got it.
So that's good enough?
Yeah.
Okay, great.
I just sit here because I have to be near Joe. Then he's not here in my home. It's your own person, unless they'll get through.
I didn't even know you got there, you weren't home.
See, you never know about people.
I mean, this is calm.
Yeah, I know.
One of my people earlier goes, and actually, they're not even on my case list, but they know me and they're like, Jeanette, sometimes I think you're on speed, and I was like, no, this is just the remnants.
It's just a remnant.
Like, you never stop. I'm like, no. What I used to do back then, when I did that, I embrace what I do now.
Yeah.
Yeah, it just kind of cracked me up because I was like, no, you wouldn't be seeing me.
No, I wasn't. You couldn't see me.
I wouldn't be here. You know, it's hard to believe.
Hey. Yeah, keep me. I'm sorry, is that rude? I don't mean to. Okay. I want to hear what Jack was doing.
Right, exactly.
Hey, lady.
Hey, how's it going?
Good, how are you? Right from my little sister. Good to see you.
Yeah. And it's.
It's so complicated. It's complex and difficult. There's no. Democracy.
So what do people do when these break off, but you can't get into your drink?
That's what pens are for.
Oh, well, I did try that, but maybe I just don't have the.
It's a sign.
Do you have like one of those mini can openers? You could just.
What's in there?
You want to open it for you?
You think you can do it?
With his teeth, he's from Idaho.
Yeah, I don't have anything in here.
Yeah, stupid thumbs, you said that, so you've got a tool, huh? Thank you, I appreciate it. It's my, wake up juice, so I gotta have it.
I brought copies of the contract, should I put those in the too?
Yeah. Not everybody likes paper, but I do.
I like paper as well.
Yeah.
And I was guessing on the number of copies.
Oh,
But. We can do for other purposes.
that was good. We're getting there. We're good though. Yeah. Okay. All gonna be here?
Or then,
You guys don't carpool?
cause I go home after.
My way through, like, I've been twice, I was going through the street, I was still, there was an accident a policeman was responding to. The other side of, where we are today.
Very well.
I'm supposed to go to my own doctor's appointment today at 2:40, and I probably was like, you know what? I'm not even gonna try it. Cause you get out here for 2:15 and be in Scotia at 2:40.
Not today.
Not today. So I was.
Heading southbound, and I had taken out the exit sign and there were right on the way.
One of the bushes.
I think it's day to,
No,
right, this is like in progress. When I wait here, if I could.
All right, it is 12:15. I would like to call to order the Behavioral Health Board meeting. Welcome, everyone. This is our monthly meeting. 1 week early because of Thanksgiving. We are the advisory board for the Board of Supervisors. We hold this meeting on the 4th, unless it's a holiday Thursday of each month, and it runs from 12:15 till we meet in person at 507 F Street in Eureka, also on Zoom. This is a public meeting and everyone is invited to attend. Members of the public may participate remotely. The minutes and the agenda can be found by searching online Humboldt County Behavioral Health Board. We provide time for public comments early on the agenda. Public comments need to be limited to 3 minutes and pertain to matters related to behavioral health. We ask you to make your comments in a respectful manner. Please note this meeting is being recorded and past meetings can be viewed on YouTube. Please contact me or any other behavioral health board member if you have any questions about our work as a board. And with that, Joe, we'll do a roll call.
Sean Berger,
present.
Ron Reed, Story
Here.
Bob Doherty,
Here.
Raphael DeCaprio.
Here.
Kristen Sumner.
Here.
Laura Montani,
Here.
Andy Roy, Steve. Jim Baskin, Steve. Tim Doty. Here. Jeanette Kellerman,
Here.
Vernon Price,
Here.
Captain Smith.
Right, we do have a quorum for Ray. And we'll do introduction of staff in the room first, starting with you, Mr. Jackie B.
Hi, I'm Jack Brazil. I'm one of the deputy branch directors for behavioral health.
Hi, I'm Deanna Bay. I'm the substance use disorder administrator for Humboldt County.
I'm Jeanette Kellerman. I'm a social worker for Conflict Council.
You're a board member too.
Oh, yeah.
Kirsten Sumner, board and social worker in the emergency room at St. Joe's.
So it's just staff right now.
Oh, sorry.
Sorry.
Okay. Laura,
He's not a person.
so we'll go online. If you can all popcorn to each other, start off with Sonia. Introduction.
Hello, everyone. Sonia Levy Boyd. I use she, her pronouns. I supervise the Humboldt County Transition Age Youth Collaboration and the peer coaches at the K Division, and I'll popcorn to Nancy.
Hi, I'm Nancy Stark, she, her. I'm the Legislative and Policy Manager for DHHS, and I'll popcorn to Alex, please.
Hi, I'm Alex Childers. I use they, them, and AM pronouns. I'm a peer coach supporting the Humboldt County Transition Age Youth Collaboration. I'll pass to Sharon.
Hi, I'm Sharon Wolf, DHHS Legislative Analyst. Good to see everybody. Please excuse the hat. It's a stormy, cold day. And I'll popcorn over to Kelly Johnson. Thank you.
Hi, I'm not actually staff, but I'm Kelly Johnson and I'm working from home today because I'm sick, so I apologize for not being there in person. And I will pass to Christine.
Hi there, Christine Messenger Communications Group. I'll pass to David.
Hi, everybody. I'm David Eichenbaum. I'm with the HCTC Youth Advocacy Board. Pass to Melissa.
Hi, everyone. Melissa Nelson, patient navigator at Aegis in Eureka. And I think that's complete. Did anyone not go?
I'll jump in. This is Kelsey
Okay.
Reedy. I use they, them pronouns. I'm a youth organizer with HCTC, and also with the Humboldt County JJDPC.
All right, so it looks like guests and staff have introduced themselves and we'll go, let's see. Two other people have just arrived in the room. Introduce yourself, Laurel.
I'm Laurel Johnson, and I am an analyst at DHHS admin.
And Director Beck is here.
Connie Beck, Health and Human Services Director for the county. Good to see you. Good to see you. Too.
And we have one guest in the room, Peter.
Hi, nice to meet you. I'm Peter Stahl. I'm the Director of Prevention and Intervention Services at the Humboldt County Office of Education.
Woohoo! All right, so with that, we have everyone introduced. Are there any adjustments to the agenda? Seeing, hearing none. We'll move on to public comments. Do we have any public comments in the room? Online? Going, gone. No public comments. The moment I've been waiting for, action items. We have 2 months of agendas, so does anyone want to make a motion to approve the minutes from 10/24/24?
You said a motion?
No,
Oh, okay.
a
So
motion. You're smart. Did you want to make a motion, Tim?
I wasn't there.
I think you wanted to do the commotion part.
Yeah, I agree.
Laurel make a motion to approve the October minutes.
Thank you, Sean. Do I have a second?
Second.
Raphael acceptance. All in favor of approving those minutes, please say aye.
Aye.
Any noes or abstentions? Those minutes are approved. Do you have a motion to approve the minutes from 9/26/24?
Make a motion to approve the minutes.
Okay, Sean makes the motion. Here's seconds all around. All in favor, say aye.
Aye.
Any noes or abstentions? Those minutes are approved. Woohoo, we're on a roll. I'd like to, we need to approve to pay our annual Cal BHB invoice for year 24/25.
I move that we do that.
Thank you, Tim. Do I have a second?
I'll second it.
Sean seconds. Any discussion?
The amount is $800?
It is 1,000.
$1,000.
Yeah, it's gone up and well worth it, in my opinion. I'll take the vote. All in favor, say aye or
Aye.
opposed. Motion carries. We are paying those dues. Yay. And now, does anyone want to make a motion to approve sending a membership application for Kelly Johnson to the Board of Soups for approval? Before that, I would like to ask Kelly to say a few words about herself and why she wants to be on this board. Thanks, Kelly.
Hi, I know most of you, so I'll keep this brief, but I am a licensed clinical social worker. I've worked in community mental health for 17 plus years. 10 of those I worked at DHHS Behavioral Health, first as a clinician, then a supervising clinician, and then a senior program manager, primarily in crisis services and forensics programs. I left to my current employer at Yurok Tribal Police about a year and a half ago, where I'm primarily responsible for coordinating the crisis intervention teams in both Humboldt and Del Norte counties. So that includes the 40-hour trainings for law enforcement and crisis responders, as well as coordinating stakeholder committees in both counties to work towards improving the crisis response systems of care. And I am very committed to serving our community. I live and own a home in Humboldt County. I lived here as a teenager, moved away for college, and that ended up being about 15 years after living and working out of the area, and then returning back home about 12 years ago. And so I'm very interested in joining the Behavioral Health Board, and I'm open to any questions you may have.
Anyone have any questions? So Sean and I did interview Kelly and think she would be an amazing addition to our board. And so with that, if anybody would like to make the motion.
I make a motion.
Second. Jill has to fill it.
You seconded that?
No,
No.
Vernon did.
Vernon did, sorry.
I'll third it.
Thank you, Vernon. With that, we'll take the vote. All in favor of sending Kelly Johnson's application?
Aye.
Aye. And
Yes.
that was everybody. Any abstentions or no's? All right, that is a motion approved. Joe will send that off, and as soon as the Board of Supervisors approves it, we will have our 13th board member sighting. Thank you, Kelly.
Thank you, Kelly.
Thank you, Kelly.
Thank
Yeah.
you all.
We have like an amazing sound system now. All right. Item E is a letter of support for the top one grant application. Did everybody get that?
I'm sorry to interrupt. Is there any chance you guys can turn the speaker down? Thank you. It's making us wake up.
Okay.
Thank you.
Did everyone receive that letter and go over it? I'm hoping that you did.
Yes.
Do I have a motion?
I'll make a motion.
What is that motion? Did you want to make that motion to support sending this letter?
Yes, ma'am.
With Prop 1?
I'll second it.
Thank you, Marguerite.
I did motion.
Any discussion? All in favor of sending this letter of support?
Are there any questions? Because Nancy is on Zoom. If there's questions that I can answer, or I know we've talked about Prop 1 in the past. We're all good. We all agree we need a new supervisor.
Oh, yeah.
Absolutely.
All in favor of approving this letter? Say aye.
Aye.
Raise your hand.
Aye.
Aye. Any no's or abstentions? It's approved. We will send that letter of support on. Thanks, Nancy. And now the moment I've been waiting for. Everyone has read through the bylaws. Great. Somebody want to make a motion to approve
I
the,
make a motion that we approve the most recent edition of the bylaws. And then, do we have a date for that? That would be dated today, correct?
yeah, yes, or is it dated the day the Board of Supervisors
Soup signs it.
signs it?
Oh, okay. The most recent edition presented to the board.
Oh, I don't see a date.
I think it is signed when you sign it.
Well, let's see, it says.
Do you know, Joe?
We, the undersigned, hereby certify that these bylaws were duly proposed for adoption of the BHB regular meeting of this date
Okay,
and approved by the Board of Supervisors. So both of those
2 days.
will go on. All right, so we have a motion and a second.
I will second it.
Thank you, John. All in favor of approving the most recent bylaws as submitted, say aye. Raise your hand.
Aye.
Yay. Anybody say no? Anybody abstain? Oh, I'm so excited. We have on this day, fill that date in, approve these bylaws, which shall be effective starting January 1st, 2025. And I am excited because that was the easiest revision and bylaw update ever.
Why January first?
There's the things that were added by the state that we need to have an education person on our board and a TAE person on our board. And that was the day that they say these things shall be.
Okay, thank you.
What's the deal? Yay. Oh. In the room. All righty. We'll all appreciate it. Now, without further ado, we have our lovely presentation from Deanna.
Hey everyone, I'm Deanna Bay. Again, I'm the SPD administrator, the substance use disorder administrator for the county. So I was asked to come here and present our substance use disorder treatment programs. So these are specific to the ones that the county provides. So it's not comprehensive of all treatment in the county, it's just county ran programs. Oh, be patient. So on this slide, you can see the 4 programs that the county runs and how participants are funded for those. So the first is Humboldt County Programs for Recovery. The levels that we serve are outpatient, intensive outpatient, aftercare and recovery services, and that's for adults who are not open to our behavioral health system of care. The next is the adolescent treatment program. It's for individuals between the ages of 12 and 18. The third one on that list is Healthy Moms. Healthy Moms is primarily for those who are not open to behavioral health services, although many behavioral, or we might open them while they're part of Healthy Moms. And provide both. So we do counseling and we'll get into that later, but we provide outpatient and intensive outpatient aftercare and recovery services. And the final one is the dual recovery program. And that's for individuals who are open up to our behavioral health system of care and are duly diagnosed with a mental health disorder and a substance use disorder. And we provide those same levels of care. So we'll go through each one of those individually. Our next slide is our substance use disorder programs are part of a 7-county network. So we call it either the regional model or the wellness and recovery model, but it's through partnership. And so partnership is contracted with the 7 counties listed there. And it makes it so individuals who need substance use disorder treatment that their county might not provide can go to a different county and receive those services without transferring their partnership or their Medi-Cal to that county. So it's a way for us to reduce barriers to treatment and have our county residents served as quickly and as best as possible for that moment.
I can't see those symbols. Could you just say real quickly the counties?
I can. It's Modoc County, Humboldt, Siskiyou, Mendocino, Shasta, Solano, and Lassen.
Can I ask questions?
You may.
So what that means is if somebody gets on a list for services and there's a spot open in Modoc County, but they live in Humboldt, they would go to Modoc?
They could go to Modoc. So usually that's for residential treatment or for a detox. Usually people receive outpatient services where they live because they're going there multiple times a week. But in theory, absolutely. And we do accept, because we have people who come to Humboldt for residential treatment and then want to do outpatient treatment before they go home. So we do have bridge that gap for people.
Quick
Now I have-
question. For online participants, would it be possible to screen share the slides on Zoom so that those of us on Zoom can see as well?
Yes, I believe so. Where's Laurel? Laurel always. We will do our best.
We're trying to figure that out. Just one moment.
Wonderful, thank you.
And no one online is able to see them right now? Is that true?
That is correct.
We can send out the PowerPoint afterwards, but if you want to just talk slowly, yeah. There you go.
I see them now, thank you.
Thank you.
Perfect.
So I guess if somebody comes here and then they decide that it's not a right fit, are they helped to go back to where they came from?
So because so all of the, that has a yes, usually. So because we're part of Partnership Health Plan and we're contracted through Partnership to provide these services, they have a transportation service. So we just have to let them know 5 days in advance. It's a little complicated, but yes, they do transport to and from treatment. As long as the individual completed. If the individual is out of county and decides to go AWOL from treatment, Partnership's not always able to assist them getting back. There are other ways to do that. And sometimes we've advocated and people have been able to receive Partnership rides, but it's, they prefer people have completed treatment before returning them.
Okay.
And keep on pushing things forward. Good job. So the first one I'll talk about, we're going to talk about them in the order they were on the initial slide. So the first one is Humboldt County Programs for Recovery. The programs really are for adults who are not open to behavioral health level 1 services. So the first 3 programs I'll talk about are.
Can you explain what that means? They're not open?
Sure. The county has, when people need services through the county, the county provides specialty mental health services. So if the participants or the people who are seeking participation in our program do not qualify for specialty mental health services, that would be our level 1, then they're a level 2 or 3, and they would be created for Humboldt County Programs for Recovery or one of the other ones I'm about to mention.
Okay. So in other words, they're non-dual diagnosed people.
That is, they can have a dual diagnosis. Their functional impairments due to their mental health symptoms do not necessitate the severity that would open them to county behavioral health. I get it. Any other questions about that?
This dual diagnosis has to be in your basis.
So we are located in Old Town. And we have our phone number. We have a 24-hour access line that connects you to Carillon. And then Carillon receives those calls 24 hours, and then they will often call back with the clinician during business hours to get that screening completed. So you don't have to go through Carillon. That's the way the program was initially done. Now, only about 50% of our applicants go through Carillon. The other ways, they come see us directly, or they'll call us directly. So those direct referrals are more often the way people are seeing us now.
What's the percentage? I missed that.
I think it's 41% or 40-ish%
Okay.
are going through Carolyn still.
Is it Cal AIM funded?
It is funded through Drug Medi-Cal.
Okay.
So primarily, it's a group-based treatment program. So individuals are offered if needed, but not as a regular part of treatment. But we do provide 15 groups weekly, and the kinds of groups are listed below. So we have an extended outpatient program that is 4 days a week. We do moral recognition, it's 2 days a week. PACE is it's for people, it's like our early recovery for this program. It's for people who haven't decided that they want to abstain from substances. So if they want to keep using and they still want to do treatment, then we have a spot while people figure that out. We have a men's outpatient program, a women's outpatient program. We have an evening recovery program. So for individuals who are working full-time or their work schedules do not allow them to attend day programs, we do an evening recovery program online. And then we have aftercare.
That's good to know.
So we talk about levels of care frequently, and so the levels of care, quite honestly, are going to change when the new ACM gets rolled out through the state. But currently, our levels of care are outpatient, which is less than 9 hours of treatment per week, intensive outpatient, which is 9 hours or more. Recovery services can happen at any level of care, but it was initially made for people who had a in remission diagnosis, but that is no longer the case. And that isn't considered treatment officially through the state. So there's a lot of more wiggle room with recovery services with timing and participation requirements. And our final one is aftercare.
Do you know what the percentages of people that, or the number of people that do the different services?
Primarily, we do the outpatient. We have, I wouldn't be able to guess our percentage. We have probably 6 to 10 that do intensive outpatient, but we do that by kind of blending together our outpatient groups. So they might do extended outpatient and then they might come back for MRT or whatever to make that 9 hours.
Okay.
What is the turnaround for appointments, for like an assessment and things like that? They show up on Monday, how long is it?
That really depends, but I think our average right now is 2.5 days. So, or at least that first offer for appointment, right? So we have a pretty good turnaround. I think the state says, I don't remember the exact of today, but I think we have 10 weeks. So we exceed that by a lot, yeah. So we're doing really good with our access to treatment. Counselors also will judge how far appointments are out. If it's more than a week out, then they're usually adding more to their schedule, more assessment slots to their schedule, just so they can help accommodate that influx of people who need that. So we have an adolescent treatment program. This is also in Old Town, so we'll get to the address in a minute. The adolescent treatment program is really a way to help connect youth to treatment early on. They mostly go to the schools, or they'll meet in the community, they'll go to youth homes. They do not need parent permission to participate in the adolescent treatment program. Just like other medical services, they can choose to do that on their own. If their house is not safe for them to share that concern, they can still get treatment through us. So the criteria is whether the youth is concerned about their substance use or another person is concerned about their substance use. So youth are in this special kind of silo. I don't want to say silo. They have special requirements for their program. They do not actually require a substance use disorder diagnosis. So if the youth is starting to drink, but they don't meet the criteria for a diagnosis, they can still get treatment through our program. So we do primarily individual counseling, and then our SUD counselors provide a lot of case management services for youth as well. So they're linking to other community partners, they're helping them get medical or dental or giving them rides or helping them with jobs, like just whatever is needed for our youth to be successful, our substance use disorder counselors are helping them.
So that phrase, be eligible for partnership healthcare, that means they're drug medical eligible? Is that what that means?
That's what that would mean. Well, and so, yeah,
Aren't all youth drug medical eligible, because?
so some have private insurance and some aren't signed up. So we help people get connected if needed. So that's why it says eligible on there.
Okay, got it.
We don't want to stop them from accessing services because they don't already have it.
Right, right.
Makes sense.
So do you want to read it? Oh, I'm sorry, moved.
It's in.
Oh, no, we're back. to
Didn't
the
look
same
like
one.
it, no.
It just jumped. So aside for a minute. So this is also in Old Town, so it's in the same building as Humboldt County Programs for Recovery. And there's, again, the ways to access youth treatment. When you call the program directly, that'll actually go to a voicemail system. So know if you're gonna call that phone number directly, you are gonna be sent to voicemail and then they will respond to you.
So I just want to be perfectly clear. So I have a 17-year-old who wants some help. This person can call,
That person can call.
even if their parents said no.
If you have a 14-year-old that wants services and their parents say no, they can still call and receive services.
Even if you have a 12-year-old.
12-year-old.
Yep. So that is, parent consent is not necessary for someone to get services. And they do that because not all homes are safe to share that concern with your parent. Right, so we don't want, we talk a lot about eliminating barriers. And if that would be a barrier, if that would be unsafe for someone to share, we still want to be able to provide treatment.
Okay, I'm gonna put this into practice. That's like news to me.
And Sherry Morley is our supervisor and she was on leave for a while, but she is back. So we, hopefully that'll help smooth things out.
Thanks.
The third program we're going to talk about is Healthy Moms. Healthy Moms has been in our community for a really long time, which is really beautiful. They're a perinatal program. So that means if an individual is pregnant or they have a child under the age of 6 years old, they're eligible for this program. Again, they also have to have partnership or be eligible for partnership. Healthy Moms is if you don't know about it, they meet in a house, they have a breakfast program, they're really helpful with moms of young children.
That's a wonderful facility.
It really is.
Yeah.
It really is. So they're over by H Street, so they're across the street from the Wood Street campus. And then again, you have the same ways to access them. You can access them directly or call Caroline's first reading, or you can go in person and pick up information.
So anybody can knock on the door and come in? They don't need to be referred?
They can self-refer.
Okay. So someone they'll go over there, knock on the door and they'll get help. Okay.
They can ring the doorbell and then someone will come out.
Okay, thanks.
I don't know if I think I heard is there some program for helping dads or other parents?
That is, so the Healthy Dads is something that people in the community used to say. Humboldt County Programs for Recovery used to have a dads group. And the parent educator from Healthy Moms would come and do, work with the dads about parenting and other criteria, but it was dad's group through Humboldt County Programs for Recovery. Unfortunately, right now, we don't have enough dads who would be interested in starting the group. So for the last couple of years, I'm like, do we have enough dads yet? Do we have enough dads? So when we have that arise and we're able to start that group back up, that is our goal. But currently that's not happening. And the parent educator still can come over and do treatment if people are expressing that would be beneficial.
How many is enough?
Oh, that's what I'm thinking too.
It has to be sustainable for a group. So if we have all 6 all at once, yes.
Okay.
Another quick question. So Healthy Moms, how much is a group of?
So Drug Medi-Cal is, we have a maximum group size of 12 participants. So that would be true for Humboldt County Programs for Recovery as well. So after 12 people, we're required to either split the group or it's a non-billable group. So they just, it's a hard no. In behavioral health, we can go over that group size. But Drug Medi-Cal has different requirements that we need to adhere to.
That seems like it should be the other way around.
I think it's for privacy. I think that so the way I think of our substance use disorder services, it was actually Linda Garrett, it was one of our ethics trainings. She talked about how mental health is evolved, right? So we know that the privacy and security around mental health is super secure. She talks about substance use disorders as being the vault within the vault. So it is even more secure and locked down and has even more privacy regulations that we have to adhere to. So I think part of that is to make sure that they're trying to retain all of the pieces.
Thank you for explaining that.
You're welcome.
Can I ask another question?
Yes, ma'am.
So if somebody, said they were unhoused, pregnant, or just gave birth, they decide to go into a treatment program like Crossroads or something, and they want to be part of Healthy Moms, can they be?
They can, they would have to be done with Crossroads. So another requirement for Drug Medi-Cal is we have to do something called the CalOWNS, which is a state tracking payment system. And they can't be open to 2 substance use disorder programs at the same time. So they would have to complete one substance use disorder program in order to be open to another one. But yes, we do take people straight from residential. Any questions about that? Does that make sense?
Yeah. Not that I like it.
But we don't have a perinatal residential in this county.
We do not have a perinatal residential in this county.
Well, we do if they've completed a long-term program. And then they can go there if they don't take any medications. And, like on and on and on.
Right, but
Yeah,
dual diagnosis.
yeah, no, they won't make them stop taking their meds, so.
And there isn't one where you can take your kids and be in residential or.
Nope. Not in Humboldt County.
Okay.
We send out of county if that is the case.
So what is it, Tula House? Tula House.
There's a few different ones. So again, with Healthy Moms, it's primarily a group based treatment program. So they provide 8 groups weekly. Day treatment is intensive outpatient. So if they're enrolled in day treatment, they're showing up oftentimes at 8:15, 8:30. They're having breakfast. Group starts at 9. And then group goes until noon. So they're there 3 hours a day for 4 days a week. Healthy Moms also has childcare for children under the age of 6. It's like a co-op childcare, so moms have to be on site in order for their children to be serviced by the childcare there.
I'm assuming this is 100% local.
Yep, it's right across the street from Semper Byron's.
Okay.
So it's
No, I
super
know
local.
where it is, but I just want to.
It's amazing.
It is amazing.
It's a wonderful program and we're so lucky to have it here.
So lucky. We have a new supervisor in our program. So her name's Ahi, and she is super fantastic. She was a clinician in the program, and now she's like the supervisor, so I feel really lucky to have her. They also do outpatient, which is a 2-day-a-week program. In the afternoons they do, and then aftercare. And then they do behavioral health counseling as needed. So they have a clinician on site who works with both mom and littles in order to work through some things and help the whole family unit succeed as much as possible. I've listed the levels of care. We've already gone through that previously, so if people have questions, I'm happy to answer those. But otherwise, we can move on. But they do the same level of care as Humboldt County Programs for Recovery.
Okay, question, I remember this program, when I was in Del Norte, is it still, where is your first baby, or is it? You can have,
So if I have 10 babies, but I have a baby under the age of 6,
yeah,
I can bring myself and my child under the age of 6 to Healthy Moms. The older children are not able to be served at Healthy Moms, but if that having other children does not preclude you from services.
So what do they do with the other children?
Usually they're in school or other things. Or they go to a different program. Like they're gonna have their choice, but we have had individuals in Healthy Moms that have older children and littles.
Are they able to attend Healthy Moms if they haven't quite gotten their children back yet?
Yes. So one of the requirements for Healthy Moms is they still have to be in some sort of reunification process.
Okay.
So if they're no longer able to be reunified, then a different program is the best to serve them. And that's for many reasons, but it would also be really hard to be in a group with 12 ladies that are all getting their kids back and you're not able to, when so much of it is focused on parenting and that relationship and that family unit. So it's really us being kind to those who are no longer able to have that.
And these the Healthy Moms, I assume, are all 18 and above, so a teenager who was pregnant would be not.
So with Drug Medi-Cal, we are not able to have anyone under the age of 18 in our groups.
Okay.
Unless they're in a group for all youth, but we cannot mix over 18 and under 18. Healthy Moms also have a behavioral health component. I touched on that earlier, but they do individual and family counseling. So they have 2 clinicians and are able to accommodate some of those behavioral health needs as well. So they don't have to be dually diagnosed. And if they need extra support, we can offer that. Our 4th program is the Dual Recovery Program. So the Dual Recovery Program is for individuals who are open up to county behavioral health. So they meet that specialty mental health level 1 criteria. They have a severe mental illness and a moderate to severe substance use disorder. We are located in Old Town. It's actually in the same building as Humboldt County Programs for Recovery, but because one entrance is on one side of the building and one is on around the corner, we have 2 different addresses. But you still access us through the same way. The behavioral health, because they're all open to county behavioral health. We have our crisis line up there and our toll-free crisis line, so they have 24-hour services for their mental health and their substance use, but primarily their mental health through this service. So if clients are open to behavioral health, they can self-refer, or they can get a referral, or they can just call us, right? If they're not open to behavioral health, then they go through our access program to get access to behavioral health services and get that full assessment and everything else they need. In dual recovery, I talked about the diagnosis. You have to have a current substance use disorder diagnosis. So a current substance use disorder diagnosis means you met criteria for a substance use disorder within the last 12 months. If you haven't met it for 12 months, then you're in full remission and outpatient would be the best program for you. We don't kick people out of dual recovery though. So if someone has been there, they're regularly attending, they're regularly participating, and they haven't used substances in 2 years, we don't tell them they can't come. We just say, hey, want to do aftercare? So people are, and sometimes they do aftercare and they still come to regular groups. Our dual recovery program is not limited to 12 participants in that group. So it's more of an open door, people can come and go. We don't close people nearly as quickly because they're open to behavioral health. So we get to follow the behavioral health requirements instead of the drug medical requirements. So we have so we do gender responsive groups. So we have a women's outpatient and a men's outpatient. We do a community group where both are combined. We have an early recovery group. So that's for individuals who are actively using and don't want to give up substances. If they do want to give up substances or they want to be free from problematic substances, because we don't ever require anyone to be fully off anything, just their problematic ones, if that's what their goal is, then they would be most appropriate for morning treatment. If they want to continue using substances and being free of problematic substance use is not a goal, then early recovery is the best program for them. We just resumed having Recovery Cafe. If people are aware, we used to call it afternoon DRP, but it's for individuals who are often conserved and the severity of their mental health symptoms make attending morning treatment groups difficult. So we have a group for people who have more intense mental health symptoms and still would like to attend treatment. We also have an aftercare group. Questions about those? All of those groups, except for Recovery Cafe, meet in Old Town. Recovery Cafe meets on the Wood Street campus. They're meeting in the Rainbow Room. So just a little bit about DRP, how we want to focus on both their mental health and their substance use. Traditionally in mental health, people have been trained that you don't work on substance use or you don't work on their mental health unless their substance use is under control. In dual recovery, we find that you work on both at the same time. So it's really important to know that they're intertwined, and recovery from both at the same time is totally applicable, and research shows that it's one of the better ways to have long-term success in reaching those goals. So what questions do y'all still have?
Does aftercare in any of those categories have a time limit?
Aftercare has, for behavioral health does not, so for the dual recovery does not. Aftercare for programs that are drug medical, so for healthy moms or for Humboldt County programs for recovery, they have a participation requirement. So if people haven't attended a certain number of groups within 30 days, we are required to close them. So, but we have recovery services and we are not required to close people in recovery services. So if someone wants to stay connected and still have treatment and still participate, we can do that through recovery services now. What further questions do you have?
Trying to get a picture of the size of the program. Seems there's so many ways people can participate in different groups. And there may be some overlap, but how many people are we talking about that the county is serving through the directive services here?
I had that on our second slide, so let me look.
Okay.
So in Humboldt County programs for recovery, we regularly are averaging about 60 to 70 clients is my best guess right now.
Okay.
I'm trying to think. That's, as I was doing the program, I was like, that's the right number, but that's a good guess. Through the adolescent program, we average between 20 and 30 active clients through Healthy Moms, and that includes, New Horizons. And then Healthy Moms, serves between 18 and 25 clients because of the intensity of their day treatment program. And then Dual Recovery has about 40 or 50 clients that we are actively serving and staying connected with.
So is there a vehicle or a way to mandate CPS, or is it all volunteer, or do they get mandated?
Substance use disorder treatment is volunteer. So they can, the courts can highly recommend it. And in the past, courts have put people back in jail because they weren't following what was recommended. But those laws are not what we're currently under. So people choose to participate. Sometimes they're mandated and choose to, and sometimes they're mandated and choose not to. CWS is the scene where people can have that on their case plan and it's a recommendation. And the consequence is they might not be able to reunify if they don't follow that case plan. And still treatment is voluntary.
And thank you for giving us those numbers of people in the different programs. Is there a significant portion of unhoused people in any of those programs?
We have unhoused people regularly in our programs. And I wouldn't be able to give you a percentage on that right now. That's not something I checked before I did this.
So for unhoused people who don't have phones, this is, the entry point is the thing I struggle with.
They can just come by. We also have people who we've gone out to other places before, like if their case manager is with them and said, hey, we be here so we can connect with them, we do that. So we're willing and able to think outside of the box and whatever that might look like.
And also sometimes I've been able, I need to get a current one, but the intake form, I'll sit with my clients and do it, and then, we drop it up at the front door, so that
You can do that. You can bring your clients to us. You can access their application. Yeah.
Yeah, I just wanted to say, yeah, I have a direct line with Debbie, and we have such a great system, and for that, you know, I have a lot of houseless patients that don't have phones, so, you know, I just call Debbie and we do as much as we can with the intake packet, and then sometimes sending them in a cab to her, you know, and it seems to work out really well. So.
Yep. We try our best to accommodate people in any of those needs that we can.
Yeah, very grateful for you guys, thank you. And I heard that you guys incentivize some of these groups, is that?
We do. I did put that on our slide. So we don't have a big enough program where we can have a case. They call it contingency management. And contingency management through the state means that they're attending group for their methamphetamine or stimulant use disorder. So when we were figuring out how we could provide services, it didn't seem fair that I might have a methamphetamine use disorder, like you.
Absolutely.
And Danette might have an opioid use disorder. So I would get cards and Danette couldn't. Like that didn't seem like that would be something that would be establish great rapport and have cohesiveness during our group. So we got permission to use some of our federal funds for contingency management. And so we use it for people. So it's I think four groups, and then Healthy Moms has their morning treatment groups that they do it in. So we do it in our extended outpatient. No, we do not do extended outpatient. We do moral recognition therapy, outpatient treatment, our women's group, and one other. So we have four groups that HCPR does. Dual Recovery, both the men's and women's groups do it. The community group is for participants from both groups that come together, so we don't do it also on that day. And then, Healthy Moms Against Methadone for their day treatment group. So it's for people who are reticent to drug test and do that toxicology screening. If they, no matter what their result is, if they are reticent to test and they test, then they get a card or a possibility to get a card. Because we do a drawing kind of system. And then if every day they attend group, so they get a ticket for a drawing for every, so if there's 4 participants in group, you get a 25% chance that your name's gonna be drawn. If there's 8 people in group, that's, you know, it goes by the number. And then we put all of those tickets from the month into a big drawing. And then at the end of the month, we do a secondary drawing for a bigger gift card for all of our participants. And obviously, because it's per group for the ones that are there, the weekly groups, you have to be in participation, you have to be there present to win. If you win the monthly drawing, you do not have to be present to win because you're still participating in our program. You just might have missed that day.
Nice. It's not, and I only found that out because I was following up with the page, and like, we got a gift card, like, that's so awesome.
Yeah, I love that we got permission for that. That's not widely known because the state, I'm sure, doesn't want everybody going to that. But we have been lucky enough, so we just kind of keep it on the down low, but we have it in writing if they ever come back at us.
With the move to Old Town a couple years ago, has there been any significant change in enrollment or participation numbers? Because I would think that it's a better location.
It's a great location to access services. I think COVID affected our numbers the most dramatically. And so we are still responding to post-COVID concerns and worries and getting people back together. Our substance use disorder counselors never went home, so they all still worked in the office and were seeing people and still testing people. Our other programs have used Zoom and other telehealth means in order to still function in both programs. So the move to Old Town has caused people to also face their triggers because it's where they used to score and use. So we have some participants who requested to do telehealth because the intensity of being there is so hard. And my answer is sure, we can do that for a little while. And there's triggers no matter where we go. So let's learn how to work through those triggers and still have a solid foundation under us.
So there's an old song about you're growing together, you're growing apart. And so you're reconciliation based. So how do you manage the other aspect of that? That your partners are not required. There's no vehicle to mandate treatment, or counseling. They have to, do the partners have to participate? So how does that work?
Well, one, we're not reconciliation based. So we're individual based. And so if an individual wants treatment, we walk with them through their goals for whatever they want that to look
Did I
like.
hear that Healthy Moms or something, yeah, reconciliation based, or was that?
You're thinking the recognition, I don't.
You have to be in the.
Oh, reunification with your child.
Ah.
Not
Because of your child welfare case, not because of your spouse. Thank you.
And you don't have to have CWS involved.
No,
Part of Healthy
You
Moms.
do not.
But Healthy Moms may be part of child welfare.
And just,
Correct.
I probably shouldn't say this, but I'm going to. It's real important, because, I'm a recovering addict, everybody knows that. So it's real important that we stop telling people to not do things. Because as an addict myself, if you tell me I can't do something, I will figure out a way to do it. I will also, feel shame and guilt behind it, to where I can't come to you and be honest. And so I think for myself, I never tell anyone that relationship's unhealthy for you. I walk beside them, we discuss, and we learn new tools, coping skills to be in a relationship and make good choices. And a lot of my people You know, I just had somebody come back from a funeral with his significant other, she was using while they were at the funeral, but he was calling me every day going, Jeanette, I'm making good choices. You know what I mean? Like, we have to start teaching people to make better choices and, learn, you know, like someone said, triggers are everywhere. But we can't be in a cocoon, you know, and we have to learn better coping skills with it. And if you tell us not to, we're gonna figure out ways and means to. And so, you know, I've watched for over 27 years, people kicking people out of treatment for looking at a girl or talking to a girl or whatever, you know, and it's like, all that does is teach them that they're, one more time, that they're not good enough. It kicks in the shame, it kicks in the guilt.
And it robs them of personal choice.
Yeah.
Right? So
Yeah.
it disempowers people. And we want to empower people.
Yeah.
In order to make their choices and their decisions. Because at the end of the day, people are experts in their own life.
Yeah.
And we get to support them in whatever that looks like.
It's such a heavy-handed approach.
I'm sorry, but like I've watched it for a year. I had a sober living home with 28 people in it, and I never told anyone they couldn't be in a relationship. I told them that if they, you know, I'm not the god of relationships. But the only thing I ask is if you can't afford to get a hotel room and go do it somewhere else, then you can't afford to be in a relationship. And that's what I would tell them. And most of the time, 9 times out of 10, they would come back with whatever choice they made, and they were like, hey, you know what, you're right, that probably wasn't a good choice. You know, so like, I think the way we've been telling people for 30, 40 years needs to change, because times have changed.
And it has.
Yeah.
Right? So not only, if you heard me talking earlier, I talked about being free from problematic substance use.
Mhm.
I didn't mention sobriety and I didn't mention abstinence. That's intentional because problematic substance use is our concern. The rest of it, I imagine if I was gonna ask, and I will not ask, but if I had people raise their hand if they have a glass of wine or a beer on occasion in this room, we would have many people raise their hands, and that doesn't mean they have a substance use disorder. It means occasionally they have a beer or a glass of wine, right? And the same can be true for our clients. If it's not creating problems in their life, then we're gonna address it in a different way. We also, the studies are going towards harm reduction, and so Humboldt County Programs for Recovery and the Dual Recovery Program have taken a harm reduction approach for many, many years. And the state is now, there's 4 conferences actually in the state this year where they're doing harm reduction summits. Because harm reduction, their finding gives people back the onus of their control in their life. And so through dual recovery, we have an early recovery program where people are actively using. And many of those people who've been actively using for an indeterminate amount of time then decide, oh, well, maybe I'll decrease this substance, or maybe I'll decrease that substance. And I have several that have come off everything, including tobacco and THC and cannabis, because they have made their own decision to walk away from things. And so I watch harm reduction be super successful because it's the person making their own choice in that and it being empowered to make a choice.
Yeah.
You had your hand up?
I just wanted to ask, has this committee had any harm reduction training, like a presentation on harm reduction through Hatcher or anything else?
Oh, my. That's the last 3 years, not to my knowledge.
I just wanted to know that, but thank you so much for that. It's so true in my experience as well as, you know, abstinence, you know, for problematic is our, you know, what we want, but I've learned that meeting them where they're at and supporting them and building that trust, that initial trust where they can tell me that they are using, they're still using a needle. But they see that I don't react a certain way and that I'm offering them some stuff to stay out of the emergency room but we're still talking about ways that we can still thrive. Yeah.
I am so glad you brought that up. Because that reminded me of something. So the substance use disorder program recently applied to be part of the naloxone distribution grant. And so we got our first shipment this summer. The first shipment of 500 plus, I think it's 504, have all been distributed. We've just gotten our second shipment. So my goal is to have, pass it out like Halloween candy, right? I want people to have it on them, so if they have a situation that arises, they can step in and be part of the solution. So
I always assumed that most people in this field understood harm reduction, but it sounds like that's not the case. And it might be worthwhile for us, because we relate to the public, at least I do, in a lot of different ways. And they ask, and so it would be, I think, worthwhile, even if it's a short 10-minute presentation.
Yeah.
Don't you think so?
Absolutely, 100%.
I think one area that's hard about harm reduction, or has been historically, is that often the courts, probation, jail systems have a much harder time dealing with harm reduction versus please get off of everything and get off now during whatever program you're in, whether or not that's realistic. But I know that that's been kind of an edgy thing, and for a long time, it's been a bit better now, I think. I mean, you could address that, Laura, but until fairly recently, it was really hard when somebody was in one of those kind of programs not to go entirely, be counseling people to get off everything and do it ASAP, or you can't stay in our program kind of thing.
And an issue I have is people who throw around the term evidence-based and don't know the evidence. I've seen people, so I know. Whoa, I've been to the national conferences and they don't know what they're saying, or harm reduction. Oh, yeah, I throw that up. And that bothers me, because that seems to be a badge that we're doing it right. And so I don't want to keep making that statement, oh, you're doing 3 out of 5, So having us learn those things in more detail, I think would be worthwhile. That's my thought on that.
Yes. And that brings me to a question I have. If they're in one of your programs, which are basically all outpatient programs, and you find out that somebody has kind of a more serious level and really ought to be in residential, is there a smooth way to help them move to residential? Because I know residentials always have waiting lists and blah, blah, blah.
So we do the ways to access our programs are the same ways to access residential programs.
Right.
You can come in directly, you can call us, or we can call Carolyn, and Carolyn will help make that. But we do warm handoffs as much as possible. We call with the client if they're able and willing. We encourage, but again, residential also cannot be forced. Right? So if they are worried because they can't take their pet with them,
Right.
or that they might lose their apartment because their apartment was under a subsidy,
Right.
then they might choose to not go to residential, which we will encourage them to then do intensive outpatient and try and wrap around supportive services in a better way. And we are in contact with residential treatment providers all the time. We are constantly assessing our clients. It's not a one and done. It's, oh, you said all of this. Let's talk about residential. Let's talk about what that might look like and explore that as a possibility. So it's our regular conversations.
Back to choices.
Thank you very much for.
Yeah, that's correct. Thank you.
So I know Emmy asked me to also bring up family wellness part, which feels a little weird, and I didn't have it as part of my slides. But she goes, I want you to also talk about your other program. So if you guys have time and are willing, I can just briefly mention it, or we can. So family wellness part, and I was remembering that with our just finishing that conversation, is for people who it's really a beautiful mix of our tribal partners and our court system and CWS and behavioral health, all working together to help individuals succeed. And so often those referrals come from CWS for the courts. They do not have to, they can also come from behavioral health, but they're a part of the family wellness court system. And they're a part of our behavioral health system at the same time. So they're still able to attend treatment and get counseling. The family wellness court is an abstinence-based only. So the rest of my programs, I've been able to go harm reduction. Family wellness court, the other participants, the other community partners, still want it to be abstinence-based. So we honor their wishes for those participants. And if the participants aren't able to succeed in there, then we can easily have them a part of any other of our programs where they will be more successful.
Awesome.
Thank you for letting me to take 2 minutes.
Good job. Great job.
That was wonderful. Thank you.
So if nobody else has any questions, or you think of questions later, who should we contact?
Contact me.
That's all I wanted to hear.
Thank you.
Great work, Deanna.
Thank you, Kelly.
Thank you. All right. With that, we will move on to discussion. HCTC recommendations review. So at the executive meeting, Sean and I and Andy and Paul and everyone else, Jeff, went over these. And so one of the things that I was tasked to do is talk with Natalie Arroyo, since she's on a few other groups, the JJDCP group. And so in the group, we reviewed what our response had been back in 2021, and we didn't really have anything vastly different to say about that. Regarding the public comments, Natalie, I sent her the video of the requests that were made by the HCTC. And unfortunately, she's not here, and I didn't know that, and she did not get back to me with any insights that she had. So all the HCTC people who are here, I guess I'm gonna ask your forgiveness and say that we'll bring this back on the agenda in January. Unless you have other requests or input at this time.
Yeah, hi. I think it's just me and David left. Kelsey and Alex had other meetings they had to jump off to. Well, I will pass the message that we'll get an update our next meeting then on the request for public comment. But I know there were several recommendations done in, what year did you say, 2021?
21.
That it would be interesting to sit back through and revisit. I know some had to do with the seating formation, some had to do with how we introduce people in meetings and asking the public maybe to be prioritized to go first versus county staff, including gender pronouns as part of our introductions, things like that, that I think at some point we tried and then drifted back away from. So I would like to revisit all of those recommendations and see which ones still could be considered or implemented. I know there was several that are probably not possible, such as compensation, childcare, maybe even changing the time and place of this meeting was one of them to accommodate pay youth better.
Yeah, Sonia, if you don't have the our response to those, we can resend that to you so you can look at it, but we did go through your requests and then the response, I think, was Tim Ash Henson Doty. And yeah, happy to send that to you, and then we can revisit again in January. That's okay.
Yeah, that sounds fine. I'm sure I have it somewhere. I was part of the ad hoc group that made those, so I can try to dig them up as well. But yeah, happy to revisit still, and want to make sure, David, if there was anything else you wanted to lift for the YAB.
Yeah, so here, let me turn my video on. There we go. Um, so yeah, perfectly understandable. To talk about this in January. And yeah, I have pretty much no comment at this time.
Okay, thank you.
Thank you.
Awesome. All right, we are now on to communications. This is where any of the board members can tell us what they want to tell us. And Vernon's not here, but he did have that stand against stigma. I was hoping he would be here to talk about it. All I can say is that I think that they're going forward with bringing that group to town. I'm not sure when.
Did you send out copies of that information?
Yeah, it was sent out. So I guess we'll just go around the room. Tim, do you have any
I just
communication?
want to say, about my own medical leave situation. And that is I had a heart attack, in July, and I had open heart surgery at the end of July. And, this was a totally new experience for me. And
Thankfully.
yeah, and it was, for coronary arteries and a valve and a lot of things like that done outside.
It's a once in a lifetime experience.
Yeah. And so, one of the things that happened to me was a severe kind of a psychotic process through that in delirium. And things that, I had an allergy that nobody knew about. And so it was really traumatic. Because in my delirium, I thought I was, well, you don't need to hear all that, but PTSD still lives with me a bit. And so there were weeks and weeks of recovery. I'm still in recovery, but I didn't know whether I could walk very far. And that's why I wanted the time off, and some of my recovery. I'm going to rehab again today, but I'm able to walk without a walker and all that kind of stuff. So that's what happened to me. There's still months of recovery, but I'm alive and feeling really good. So
Happy about that.
okay, thank you.
That's wonderful.
Glad you're here. Bob, do you have anything?
A couple of things. One is we did the Source Plowshares presentation. I sent out an invitation for that, and Swords to Plowshares, they're a very large veteran organization, and they do a lot of veteran services, rapid rehousing, those kind of things. And that was geared primarily toward the non-veteran population to kind of gain some understanding about some of the issues that veterans face in society. We can be viewed as kind of a different breed of cat, and we got lots of good reasons for that. And they are finding ways to assist veterans who are struggling with those issues, not just PTSD, to be able to fit into society. Coming from a military occupation was not an easy task. So that next time that comes up, I encourage anybody to watch that. It was an excellent presentation. The other thing is I'm also the chair of the Native Veterans, Native American Veteran Coalition. And so if you know any Native veterans, we have a once a month Zoom meeting. You can get a hold of me for the link, and that's through the VA. And we're looking to identify and recruit members to be part of this coalition so that we can get a count, because nobody knows how many Native veterans there are. Because there's no, the people that do count don't talk to each other, so we don't know how many there are. The tribes don't share that, with each other. Just we don't know yet. So, but the purpose of that is, to start having a conversation around needs so that we can start addressing those needs through grants or through federal funds. To do. So,
Thank you.
Okay. Bob, I don't recall ever having a presentation in this board meeting over the years that I've been here that had to deal with directly with mental health services in our county. I know someone used to work with them, but I don't know that we know so much very specifically here. And it would be nice, I think, to have a presentation sometime, 10 or 15 minutes of what those services are in Humboldt County. That's all.
I just happened to have met the outreach person a couple hours ago. And so I can probably somehow give you guys his name and number, to that website Nation's Funds.
Well, they particularly asked us the state to include that, in what we do now.
So
And so have some presentation of what's going on.
we could set that up.
Yeah, that would be cool.
I think you did a program, a presentation in our program, we had our staff meeting.
Beautiful.
Thank you.
Or Bob, do you do the presentations?
I would probably pass that to the director. This would be, for the veteran community.
Yeah.
So that would be better, just, I will bring it to them, and ask them to, if they can't get that scheduled. They'd be happy to do it. Thanks.
John? Raphael?
If I talk about.
Do you have any communication?
Oh,
As a-
yes, communications, I'm sorry. Yes, there is, so yeah, there is we are working on a new withdrawal management, facility, and that's in the works. About withdrawal management services, hopefully, the licensing process will be starting soon. And then I'll be able to report more on that.
That's amazing.
Yeah, yeah.
Marguerite?
I'll say something more at the SUD time, but I just wanted to say that, as probably one of the only people on the board that's retired and not working, if there's any new programs in either mental health or substance use, I'm willing to go with somebody else if you want to visit that program and report back, because I have the time in my life now, which I wouldn't have had when I was, working in SUD services. So just want to kind of put that out there. I'd already told the SUD committee that, and I've done a few things like that, one of which I'll report on with the SUD report, but just kind of keep that in mind, that I'm willing to do that and report back.
Marguerite, I've retired 3 times.
I'm still. That's something I like to do, know how to do,
Yeah.
write up reports. I mean, it's just in my skill set, so.
Thank you.
Thank you.
Kirsten, you have any?
Thing of significance.
Danette?
So my name is Danette Kellerman. There's a couple things, want to talk about, December 9th, we are attempting to, meet up with some people at Mother Bernard's to, start a UBU group, because, a lot of our people that have challenges, I've noticed from the rooms that I hang out in, that they get the eye roll and people don't really want to hear it, they don't feel safe. And so, we're gonna sit down and talk about it on December 9th, about what they'd like to do. And so, I believe it's gonna be an open meeting for people with mental health challenges or others. But it's so people can just be them and not have to talk a certain way and act a certain way and, not talk about this anyway. So, just my perception, and then today Recovery Happens is putting on, Thanksgiving, dinner at, Mother Bernard's for the people that are, that live there. They're low income, and a lot of them don't have a lot of money, a lot of them are pretty much, I guess we can call it shut-ins, like they use for other people. They're just, they're in their apartments, and, so my hope is to start building some, socialization skills with our people. That, I have a few clients that live there, so, like I'm just making it all inclusive. And so, just want to share that, and then, like we just keep doing this thing called life, and, the holidays are really rough for our people. And, it doesn't matter where you come from, they're rough, and so, I just want to make sure that everybody knows, like, be kind to others, we don't know what they're going through, and so, yeah, that's all I have to say.
Thank you. All I will say is we are gonna be on CBS News for our weather. They came and rode around with Commander LaFrance
I
and,
saw it this morning.
pardon?
I saw it this morning.
Well, they just filmed something at noon today, so it might be something different, but apparently Rob Marciano is a famous reporter, so.
He was up in Trinidad, they showed it on, I think it was like CBS or something.
Okay.
Yeah,
There'll be
but
more.
he was in Trinidad. I just think it's funny that they say Eureka to Fort Bragg on the world news, and I'm like,
And this,
Fort Bragg's on the map, you actually see that? It's incredible.
Avenue of the Giants is closed. They're just-
So with that,
We're getting there's a lot of flooding going on right now, if you guys aren't aware. There's some pretty big water coming there. I live in freshwater, and I'm gonna be like locked out between like worse and nice, so that's not a.
no.
I've heard it's 14 inches of rain in
Take it.
3 days, which is an awful lot.
Yeah.
I have to work tomorrow.
So Emmy and Oliver are at a conference, and so that's why they're not here today, and so I'll just mention that. And, it's on racial equity, and I hope that they bring back a lot of really great things, because I'm sure that it will be really great. I was trying to figure out what I could talk about that I haven't talked about here recently. I'll let Paul talk about crisis triage and all the stuff that we're doing around buildings, but the one thing that I thought of is, I've been working on co-location with the Hoopa tribe for, years. And we finally have our lease done, and staff are moving into the Health and Human Services building in Hoopa alongside Hoopa, Tribal Social Services staff. It's very exciting. We'll have our child welfare social workers along with, a clinician, our eligibility worker that had been stationed at Kamau in a little trailer for years and years. She's moving to the facility too, so we'll have all of those services in one place. So we're gonna do a little ribbon cutting, and I'm hoping that this will be the beginning of providing additional prevention and other services in the community there. But it's a wonderful opportunity, and historically, we've tried to find little space available in Hoopa for us to rent, so that, we're not, the driving time takes away from the time that we actually get to do work there. So
We have people that live out there that are gonna be able to work out there. We have people, even our eligibility worker, lives in Willow Creek. And so we'll just have that short drive. So super exciting. And like I said, it's been on my list for a really long time, and to be able to just check that off, it's just been like so wonderful. As we've gone through, you know, I think 3 different chairs, 2 different social services directors for the tribe, like there's been like this crazy process, so it's very excited.
It's good to have a victory to check off.
It is, and all the other things that I deal with, it's really nice to be able to say, yep, I finally got that done.
Do you know when the ribbon cutting was?
No, I don't. Our move-in date is December 9th. And then we have, a week later, we have a working session, with the tribal council. But yeah, it's really exciting.
Good job. Yay.
Dreams
really do come true.
Right?
That's what you got. All right. And we smell here.
I have can we back up just for a second?
One.
What date would you like the issuance finance to be there? You already said, okay.
I'm sorry.
Oh, we need to bring that to executive.
Executive committee, yeah.
So, because we have the calendar and we work on that.
Okay.
So just refer that.
Way to go, though, thanks.
Okay.
Yep.
Got you.
Thanks.
Then,
Good job.
Who are you talking about?
What do you think?
There's a lot of exciting things happening right now. We're, been working with, Boulder Associates on 2 big projects. One is, of course, the Crisis Triage Center, that we're working on, in collaboration with lots of folks, Cal Poly, Humboldt, Mad River Community Hospital, of course, but this is shaping up to be a great building. It's looking like it's gonna be 2 stories, and we've got you know, the sobering center, it's gonna be in there, an expanded crisis stabilization unit for both adults and minors. We'll have some more crisis residential as well as SUD residential treatment. So really looking forward to that. But yeah, great effort, and the design team's really pretty top notch. They're really great to work with. So excited about that, and then.
And youth, that's also right.
What's that?
Youth also need
Yep.
crisis.
Yeah, youth crisis beds, and they're kind of nice because we can they're designing it so we can throttle up on beds or throttle down on beds based on the need. So we can go up, and not have commingling between minors and adults. So really nice design that they're coming up with for us. So.
Yeah.
Really looking forward to what that's gonna mean for our youth in the community, so that they're not having to, you know, they can have great care with dignity. So really excited about that. And then, the other project is we're working on a plan for a redesign of a new building for Central Virus and our crisis, stabilization unit. So that's been exciting. We're working with Boulder Associates on that one as well. So that's coming along. We saw our first design presentation this week. So I'm super excited about that and how that looks. So we got a good team together that's working on that. And we're also, as you may know, our Semper Virens and the CSU have a waiver from the state that we can treat minors on the unit. But because the facility that we're working with right now, it's really difficult to do that effectively without impacting the number of beds and the number of folks that we can treat. So we really haven't done that much. So this new design will allow us to be able to treat minors on Semper Virens without commingling. So we'll have swing beds there as well. And then the CSU will also similarly, we'll be able to you know, have 2 or 3 or 4 or however many beds we need for adults and minors to be able to treat them both at the same time without commingling, so super excited about those projects.
Will the number of beds go beyond 16?
No, we're staying under that IMD exclusion, so, yeah, we're still an acute psych though, so we'll still be a super puff. So we're excited about that.
I think nationally, we've been fighting that for decades.
Yeah.
Decades.
Yeah, that's true.
And the funding is secure for the crisis triage center. The funding is secure for the design of Semper Virens, but not for the building.
Yep.
So that's what the grant application is for Prop 1.
That's right.
If we don't get that, we will at least have the design done for Semper Virens. So when the next time there's funding available, which there will be unless something really awful happens, there will be, and we'll be ready to apply again. If and when we don't get the other.
Yeah, so cool.
Yeah, the not so fun part is doing the Prop 1, application.
The work.
But it's a lot of work, so we've got, we're hard at work on that right now.
You guys do a great job.
Thank you, Danette. Thank you for that.
I certainly think that the chair of this committee should be able to see those. So that I can share that information with everyone.
Well, we're
Just
just in the
saying.
preliminary, so we're still working things out. So,
Just wanted to say that. Okay,
yeah.
that's it? That's all
At
you
some
have?
point, I do feel like it would be fun to be able to share the design
Yeah.
and actually a little more around the crisis triage center. And I just have to say, mentioning that, I have to say, the crisis triage center build is being driven by Mad River. They own the property, so it's really their project. They wrote the grant along with Connie Stewart and staff, so I just wanna say it's their building, they're
Yes.
doing a lot of that work, and we are participating, and we plan on being in the building at some point, or at least have contractors doing that, but I wanna at least acknowledge that's really important.
Definitely, we couldn't have done this without them. They've been so
Absolutely.
great to work with.
Yeah.
I just want to say this, and I know Tim Ashley's been saying this, to help the board be involved with the advising and the reviewing, the more participation about information, even though it's not decision-making, helps us, I think, feel like we're a part of it and to do our work. I think I said this before, one of the things we do as a board is we're representative of the public and we can listen and be aware of it. So,
Yeah.
you know what I'm saying.
Great point, yes. And, we can bring that back to the team and talk about that. I know we've also had that discussion around some of the stuff that's happening on the justice side too, and the expansion that's happening there with, the contracts with the Department of State Hospital and our diversion program and our community-based restoration program. There is so much going on with,
Oh, and there's a grant application for IST right now.
that's right, yeah, we're working on it.
And trial.
That's right, that's right. So hopefully, instead of folks going to state hospital, we'll be able to treat them locally. So we're working on a project there, aside from what's happening in the jail with the JVCT program, so. A lot happening right now. It's super exciting to be a part of that.
That would allow folks to actually get to treatment instead of sitting in jail waiting for a bed at state hospital. They'd be being treated locally instead. It's a lot.
It is a lot.
Yep. When I look at this list, I go, "Oh."
Yeah.
And I enjoy telling people who complain, we have so much stuff going on here. Oh, it's gonna take forever. Nope. It will take time, but it will.
We're still moving forward.
Absolutely. All right, SUD committee. Thank you, Paul.
Wait, Jack.
Oh, Jack. Oh, Jack. Well, I feel like you're right. We used to take.
Yeah, just guys
somebody at a time.
do it. I didn't say anything. Things are all really exciting.
Okay, sorry.
No, I actually just have one thing to say, to bring up, that, So we've talked in here about the BHBH funding, housing, and one of our projects with that, not the only project, but one is the new ARF, the 16-bed adult residential facility out in Cotton. So we're, just heard this week that we're hoping maybe the second week in December, third week in December. So these are gonna be primarily for our LPS serves individuals who are ready to step down from locked facilities, some center hiring.
This is done and everything.
It's all done, yeah, they're hiring staff right now and, so it'll be, maybe some step downs from some environs, but a lot of places like Crestwood where people are stepping down, and they'll be local, so we're bringing some folks home from Modesto to come back to Humboldt County and from Yuba City and from, other places where they're living currently, so they'll be returning home. So that'll be nice. Yeah, Lighthouse, the Lighthouse.
A lighthouse, all right.
How many beds is that?
It's 16,
Yeah,
yeah,
it's a wonderful place.
yeah, it's really just, as I've mentioned, real just fortunate it all kind of came together for us on that, so.
Are you gonna do a open house?
I'm not sure, I've texted the director there from Willow Glen, but I think he's just been really busy, so I haven't checked in on the details so much of it, but I hope so.
Let me know.
Yeah, I will.
Okay. Thank you.
Yeah, no problem.
Sorry about that. And for now, the SCT committee.
So, Dannette passed it to me just because I did one visit. It was actually a visit that probably wasn't that helpful to our committee because I think so many people on our committee, thankfully now, are very, very well aware of all the providers around, but I hadn't been to Feather House. So I went over to Feather House with Eric Thompson and we went to the one that's on Hillsdale, which is a 20-bed men's transitional living. They also have a 15-bed men's transitional living on 15th Street. And then they recently, as in June, they opened a 6-bed women's facility in Fortuna. So I think most of you know, but for transitional living is a great opportunity for people coming out of residential or really any level of alcohol and drug treatment, so substance use disorder treatment, to live in a safe place where they're required to kind of get their lives back in order. So people there are required to either work, go to school, or volunteer. And it's the work that they do goes toward payment of a $550 a month rent. They help people apply for general relief, which is $303 of that and repayable, unfortunately. While we were there, though, we've been trying to be very careful on all our visits not to buttonhole clients because it's confidential. 2 clients came into the room and they wanted to participate, so they sat down. One was a young man who'd only been there for 3 weeks and talked about how great it was to be off the streets and, back in, a safe place. And another was a man who'd been there for many months, who was a senior. And we also were able to look at parts of the facility, so to get an idea of, what the living space was like. It was very neat, very accommodating, very clean. I have nothing but good things to say about it. And we met with the director and the assistant director and the counselor-like person. And it was a really great visit. So I just, wanted to say that. They did say something interesting, and you may actually know more about this than I do. They said that because there's a new transitional living that just opened at the Royal Motel in Eureka. A number of people left their facility because they're people who are on SSI, which doesn't pay for them, but that's, you know, anyway. You know, I haven't been to that facility, but you may know more about that, and you want to say something about it?
So New Life Discovery Program has nothing to do with SSI. It is a program, a program that is paid for by partnership for people that have came out of treatment or come out of jail, that are, trying to get back on their feet. New Life Discovery has, and I was hoping to get the lady to come and say all this, but here I go. So, there are 2 people per motel room, that are paid for by partnership. They provide 3 meals a day. Has nothing to do with their SSI.
Oh, okay. That was said to me several times when I was.
Absolutely, absolutely nothing to do with SSI. In fact, it gives people the opportunity, up to, it's usually 3 months, but it could be up to 6 months, for people to get on their feet. If they are on SSI, they can save their money so they can get their own housing.
Yeah.
If they do get a job while they're there, they can save their money so they can get their own house. It gives people the opportunity to get a step up. It also gives, you know, they test, they have support, they meet with a counselor once a week. And so, yeah, it has nothing to do with anything, but it's part of partnerships way to help people that, you know, maybe have mental health or medical or substance abuse, issues, and are referred by someone that knows that these people are willing to do the footwork.
I just found this out, that, they don't want people right out of detox.
No.
They have to be at least 30, they prefer 60 or 90 days of being in a program. Then, that's what I'm discovering. They also have the days in too, they just took over. So some of my guys moved from the Royal. If you're doing good, you know, they see that you're you know, you don't need a lot of supervision. They will step you down to, like, I guess it's a lower level of supervision, basically.
They actually just moved 2 staff members down there.
Yeah, awesome,
To keep an
cool.
eye on them. Yeah. I have a few people there, and I because it's close to my office, I stop by a couple of times a day, you know, and I'm able to help in situations, you know, to get people where they need to go to get on their feet. You know, like
So
this.
this is housing that's available, transitional housing that's available through partnership, so
And Callie.
is there, so there's a referral process, I imagine, that you ask for the referral, you ask for the, I haven't heard this before,
They just opened.
and like
I don't know what now.
our home program staff,
They've heard of it, yeah, it's been.
they have?
Mhm.
Gosh, I didn't even know it existed. Somebody asked me what was happening there and I'm like, I don't know.
They're based out of Reading, the faith-based program out of Reading.
That's great.
And the director, her name is Elle, she's wonderful, but Carrie is, I think, one of the lead counselors there. And she's, you know, yeah, it's a wonderful program, like, maybe we should have her come to it.
Well,
So they're allowing folks out of jail and out of treatment to be there?
If they get a referral from jail, based on, yeah. they do.
Wow, that's
It's called recuperative care. And
Yeah.
so, yeah. I can tell you though that like the other day, there was, a gentleman that was referred there that doesn't meet criteria. And so he wasn't allowed to come in, you know, so, they try not to have a lot of, how do you question? A lot of behaviors that could get the place shut down.
Yeah.
Yeah, the place I reported about the Feather House, it's definitely for people, SUD people who have done some kind of treatment already. And they actually said that they could get referrals from the VA too, and they get referrals from the jail. And, so they've got a little bit of flexibility, but it doesn't work well if it's for somebody who's had no treatment at all.
Yeah.
To go to a transitional living just because they're unhoused. That isn't the idea.
Yeah, but if there's 2 people per room and it's Royal and the other one, that's a lot of beds. That's a lot of people. That's great.
Yeah.
When they first opened up, there was a period there was a lot of open beds in the sober living houses.
Yes, yes.
But now those beds are filling
Now they're filling up, yeah.
They are,
You know?
they still have some open beds.
Yeah, that's what the, Brad Davis said to me, was that they lost a number of people to the New Life program recently, but they are sure that they're gonna fill up really soon. And it's really neat that they have a women's only facility now in Fortuna. That's pretty unique.
Yeah.
Is it all right if I add a little?
Sure.
So we've contracted with, the county has contracted with Brent, with Feather House for a long time.
Yeah.
And so we have encouraged him to no end to open a women's house. And so we were so thrilled when he was able to do that. And so our contract for the county just got signed. So we will start having some people who are actively involved still in treatment and being at the house.
And part of that's AOD, right? That part of that contract?
So they have
In
to be
order
in
to-
substance use treatment.
Good, okay.
And he said that they've got a $500,000 grant from some housing something to help pay for some people at Feather House through the the housing movement versus the treatment kind of movement or FUD. It's not FUD money, it's housing money.
And Debbie Todd, who Raphael mentioned earlier, is our substance use disorder navigator, who helps assess need and criteria that we still have to adhere to for triaging people to help with that program.
That's great. So when Paul Winrowell says that their team is referring people to Calais, that's actually
Could be.
that
Yeah,
happens.
they do have Calais. I know, I
Okay.
spoke with Cal. They are receiving Calais. Quick question for you. Is funding opening, so you said funding for the sober living. Is that, I remember last year, there were some folks that wanted to be a part of that have some sober living homes. Is that open for them to enroll, or do they have to wait another year?
Are you talking about people who own or manage other sober living
Yes, correct.
homes? So we have opened it up several times and there were letters of interest out. But the insurance requirements and other requirements are a barrier to having very many other people apply. We've had, quite honestly, 0 other people complete that application process and go through that contracting process with us, even though we've opened it up several times.
Is it still open now, or is it closed? Okay. Do you know when it will be open again?
Probably when we're looking at contracts, so I think it's a 3-year contract right now with that other house, so probably 2.5 years.
I was just have to say, I was personally really thrilled that they got this $500,000, et cetera. So it was so hard 3 years ago to watch HA's transitional living go away because they couldn't afford to stay open anymore.
And
So
for
this is
clarity,
the-
that's not all for us.
Awesome. Thank you for that report. There aren't any other committees at this time. We still need to get the Children and Families Committee going, but we will work on that soon. Chairman, Vice Chair, I've got nothing. We're on a time crunch here. I don't know. Do you have anything? Nope. All right. Unfinished business, Navigation Center, anything new on that?
Not a thing.
Not a single thing, but it's still gonna be here. We're still gonna have it.
I believe the architect's still working on the design, he's just not communicating with us much.
Oh, I'm happy to communicate with that person or entity. And care cord, I don't think we,
Care Cord's moving right along, whether we're ready or not. I did hear it depends.
I did notice somebody in court this morning talking about not able to submit something till December 1st, like a care cord, and the public defender was like, care cord? What are we doing here? So. Everyone's aware. For future items, I have veterans mental health, harm reduction, new life discovery, possibly. Does anybody have anything else? Oh, hearing nothing, I will say this meeting is adjourned at 14:09, still 5 minutes under. Thank you, everyone. Stay awesome.
Thank you for the
Start your thing.
presentation.
Yeah.
I had
Bye, thank you.
Or do we have a December meeting? We don't. do we?
No, we don't. Oh,
I had a formatting issue, so
you can do it old fashioned and write with your.
I was going to, that would have been even longer to deliver. So anyway, you did read